welcome to Cure Talks. A very happy new year to all of you. I'm Priya Menon, your host. Today on Cure Talks, we are discussing integrative oncology. We have with us two very well-known integrative medicine specialists, Dr. Donald Abrams and Dr. Kavita Mishra from the UCSF Osher Cancer Center for Integrative Medicine. On the patient experts panel, we have cancer advocate Cynthia Schmielewski and Jim Wickstrom. Welcome to Cure Talks, everyone. Thank you for joining. I know today's topic is not a single topic, it's actually a set of topics. And I'm going to start with a question to you, Dr. Abrams, first. The philosophy of integrative medicine is to treat the entire person and not just the disease. And even today in this world, holistic healing is still a niche approach. Do you see a conflict with the current mainstream disease-focused approach? Or how do you see these two approaches coexisting in the mind of a patient?
Very good question. So yeah, integrative medicine and integrative oncology is patient-centered and relationship-based, and it integrates the best of evidence-informed complementary therapies with conventional cancer care. So at the Osher Center for Integrative Medicine, I am being a consultant to patients who are having their cancer treated by another oncologist. So what I like to tell patients is that cancer is like a weed and someone else is taking care of their weed, and it's my job to work with the garden and make their soil as inhospitable as possible to growth and spread of the weed. So I'm not really focused on the weed killer per se, but on how they fertilize their garden. That is what they eat, what supplements they take, how they are physically active, and how they manage stress. And so, I think that the two are quite complementary when they're integrated appropriately.
Mm-hmm. Dr. Abrams, I'm going to circle back to you, but before that, I'd like to get Dr. Mishra on as well. Dr. Mishra, I wanted to always ask you, you're a radiologist, and integrative health and integrative medicine is a very broad area. How did you find yourself in this discipline of medicine?
Thank you for a great question, and thank you for having me join with Dr. Abrams. I'm a radiation oncologist, and so for the last 20-some years, I've been treating cancers with, most recently, proton beam radiation for very rare tumors. But I've always had an interest in integrative medicine, integrative health, even since I was a child. And I grew up around yoga and turmeric and meditation and some of these mind-body practices. And when I took a year off, a sabbatical year, a few years back, about 5 years back, I traveled around the world with my family, my two kids and a husband, and explored mind-body practices around the world out of my own interest. And I came to realize that I really wanted to be in this space. I have a public health background, and I found that this space really brings together my medical mind, as well as my public health mind, as well as that mind-body medicine practice. And so that's a short version of how I've gotten here.
Thank you. Dr. Mishra, can you explain, I know you did mention yoga, meditation. What are the various elements that are included in integrative oncology? Other than, of course, yoga, meditation, and probably exercise. What else?
Integrative oncology is very broad-based, and Dr. Abrams gave a really nice definition of it. Yeah. Obviously, we've talked a little bit about meditation, mind-body practices. That is a whole bucket of practices, including mindfulness-based interventions, guided imagery, yoga, tai chi, qigong, relaxation response, biofeedback. Some will also include nature medicine, nature therapy, art, music, dance. It's really quite vast and variable. Then you have lifestyle modifications, things like diet, exercise, and then you have, and manual therapy also is somewhere in the midst of that. And then you also have natural products, supplements. And so the rubric generally has been natural products, lifestyle modifications, and mind-body practices.
I do want to add just to that, if I could, that I'm a big fan of traditional Chinese medicine.
Mm-hmm.
And
Perfect.
again, there's Ayurveda, the medicine of India as well.
Yeah.
To me, traditional Chinese medicine is key for caring for patients, particularly those who are undergoing acute treatment of their cancer with chemotherapy, radiation, hormones, even the immunotherapies and targeted therapies. Traditional Chinese medicine is all about expelling evil and supporting good. Modern Western medicine really focuses on expelling evil. When people come to see me, I try to support good. But when you go to traditional Chinese medicine, they do both at the same time, but from a different angle. So they won't say you have metastatic estrogen receptor positive breast cancer. They're going to say you have decreased spleen qi and increased kidney yang, and they'll treat that. And I just do believe that my patients, particularly those getting chemo and radiation, do much better if they're concurrently getting acupuncture from a traditional Chinese medicine practitioner. So for me, that's one of the real keys of integrating East and West, if you will, together.
That's very interesting, Dr. Abrams. In fact, here in India, when we actually do practice a lot of Ayurveda, we do take a lot of Ayurvedic medicines for, that's usually our first go-to. So it's like really, if we can actually make East meet West, I think it's really great for cancer and other diseases. So Dr. Abrams, I know last time you came, we had an entire show on supplements and nutrients, and the interest is really huge among our audience. So I like to ask a few questions on those. We know that there's a lot of interest regarding vitamins and supplements, as I said, and this is, of course, a big business also. And what are some, how can you advise people, how to approach this sort of area in terms of cancer care? What are some of the commonly relevant supplements or vitamins that a patient with cancer should be taking? Or what are some of the questions they should be asking their nutritionist or their doctor regarding this?
Yeah, that's a great question. I think I would say that people should approach this carefully because the traditional oncologist is very fearful of patients taking things that they are not prescribing. And their concerns are twofold, really. Number one, that the supplements, particularly some of the botanicals, may interfere with the enzyme system in the liver that breaks down pharmaceuticals. And it could either ramp up that enzyme system so it breaks down drugs too quickly, making them less effective, or it could inhibit the system so that it doesn't break down the drugs that the oncologist is prescribing as quickly as they think, making them more toxic. So that's one thing. The other thing that's always of concern is that radiation therapy and some chemotherapy drugs work by creating free radicals of oxygen. Oxygen normally exists as two molecules linked together, but when they separate, they create so-called free radicals or reactive oxygen species, which knock into our DNA, leading to aging or cancer. Antioxidants take those free radicals out of circulation so they don't do damage. So if patients are taking antioxidant supplements, vitamin C, vitamin A, vitamin E, coenzyme Q10, even melatonin, while they're getting radiation, which is generating those free radicals, or the chemotherapeutic agents that do that, taking those out of circulation is defeating the purpose of the treatment. So one needs to be careful. And that's why most oncologists say, stop everything while I'm giving you radiation or chemo, but that's not really necessary. My main go-to supplements, I like vitamin D. I think low vitamin D levels put people at greater risk for cancer, and people with cancer whose vitamin D levels are low don't do as well as people whose vitamin D levels are normal. So the only blood test I measure on patients I see at our Center for Integrative Medicine is a 25-hydroxy vitamin D to see where they stand. And I aim for a level between 40 and 50. Other people aim higher. I think that could be dangerous because it could lead to deposition of calcium in the coronary arteries or the aorta. Calcium is something I also recommend for people because I ask people to stop consuming dairy products. And so Dairy is the major source of nutritional calcium. So I think a little calcium supplementation, especially for patients who are on hormonal therapies for breast cancer or prostate cancer, where their bones might be put at risk. They need a little calcium supplement. I say a little because for men, too much calcium can increase the risk of particularly aggressive prostate cancer. Calcium also decreases the risk of colorectal cancer. So I like vitamin D, calcium. Calcium constipates, magnesium does the opposite. So I usually ask people to get a calcium magnesium supplement where they're both together so that you get that balance. And magnesium is also calming, and magnesium, like calcium, is also good for bones. The other supplement that I like for most people is fish oil or omega-3 fatty acids, because those are anti-inflammatory and a little bit maybe antidepressant, although the evidence is somewhat mixed on that altogether. And then finally, the one, I mean, I like turmeric from Ayurveda for inflammation and decreasing colorectal cancer, but I'm a big fan of medicinal mushrooms. And this is one where my oncology colleagues are always fearful, patients taking mushrooms, because we live in a fungophobic society. We're fearful of mushrooms, whereas Asia and Eastern Europe are much more loving of mushrooms. But we're always afraid that mushrooms are going to damage the liver or kill people. But the cell wall of a mushroom resembles the cell wall of a bacterium. So when people ingest medicinal mushrooms, particularly my favorite is turkey tail or Trametes versicolor, their body thinks they're being invaded by a bacteria, and it mounts a non-specific immune response, which we also hope will attack cancer. So I often recommend mushrooms. I don't for people with lymphoproliferative malignancies, lymphoma, myeloma, chronic lymphocytic leukemia, because I feel their immune system is already stimulated and I don't want to stimulate it anymore. And I don't recommend mushrooms currently for patients who are on immunotherapy for a similar reason, because the new checkpoint inhibitor immune therapies can really potentially have such great therapeutic benefit. I don't want the mushrooms to compete. And chemotherapy is generally a pretty potent antibiotic. So I do recommend for patients who have had chemotherapy that they consider taking a probiotic. And this is all a lot of information. I'm now a scientific advisor to a company called Wellcasa. And Wellcasa has a website that both physicians and patients can utilize to look at potential interactions between supplements as well as their cancer treatment. So that is a resource that I think people might find valuable. I do have to disclose that I am, again, a paid consultant to the company, but I think it's something that people might find quite useful.
Thank you, Dr. Abrams. I think you answered almost all my questions there with, touching upon antioxidant supplements and not having dairy and vitamin D and calcium supplements. So thanks a lot for that. Dr. Mishra, can you talk a little bit of the adaptability of yoga, mind-body practices for cancer and how it is being integrated into the mainstream medicine?
Yes, again, great question and a lot of interesting pieces. So let me just break that down. Mm-hmm. Yoga, mind-body practices are a really complicated concept, a bucket that holds a lot of things, as we've talked about. One of the definitions that has resonated for me over the years is, like we exercise our body, these mind-body practices are exercises or trainings for our mind. To really develop that connection between our mind and body, to increase awareness, to deepen wisdom within, and potentially help in our healing process. And going back to your question earlier, the beauty I feel about integrative oncology is you are really trying to bring together your own inner wisdom of healing, as well as that outer wisdom of healing, and that can come in so many forms. So mind-body medicine really tries to grab into that space. And you may know this, but for others who are listening in, yoga, the concept of yoga, as I have learned it traditionally, one of the definitions that really resonates for me is connection. whether that means to you connection to your body, connection between mind and body, connection between self and other. But again, coming back to that idea of sort of deepening our wisdom, understanding the mind-body complex, which is honestly the most complicated thing out there. I work with a really complicated machine, but this mind-body complex is, a bazillion times more complicated. So because it's such a complicated field, it's also really hard to study it. Because in medicine, what we try to do today is you have an intervention and you have an outcome. So, we may have a chemotherapy drug or a radiation protocol. We either give it or we don't, and we follow those patients and we get an outcome. In mind-body practices, there are so many types of interventions and so many types of outcomes. And those outcomes may be physical changes in our body, pain, fatigue, sleep difficulty. They may be psychosocial differences around depression, anxiety, fear of recurrence. It may be cognitive, kind of our more existential questions as we go through the cancer journey. It may be interpersonal. And so what makes this a challenging area to adapt to cancer is how do you really study it? What type do you intervene on, and what are the outcomes you're measuring? Having said that, we, over the last few decades, as a nation and as a world, have really, in the language of our current medicine, been able to study these mind-body practices via randomized controlled trials, via meta-analyses, via systematic reviews. And so we find that now, based on really good data in our current language of medicine, we can actually add to our national guidelines saying, hey, we now know that mindfulness-based practices, movement-based practices like yoga, tai chi, qigong, meditational practices do have benefit for cancer-related depression, anxiety, fatigue, quality of life, stress management, sleep. So for example, breast cancer, ASCO, the American Society for Clinical Oncology, just came out over the last few years with recommendations for anxiety, stress reduction, depression, quality of life, to utilize things like music therapy, meditation, stress management, yoga. Mindfulness-based interventions like MBSR, mindfulness-based stress reduction, which generally is taught as an 8-week course, has been recommended for chronic pain, as has individualized exercise programs and relaxation techniques. So we now know that though this is a really difficult area to study, we have been able to study it in some form. And now we're actually adapting it into our cancer guidelines based on the evidence. And the last part of your question in terms of how do we really integrate it into current practice, it's complicated. And Dr. Abrams has been a real pioneer in the field, and he's sort of seen it grow from a real baby to maybe a toddler now. But we're still in the youthful phases of growing this field, I feel. And then there are a whole lot of resources, both at the hospitals, in the clinics, courses, online, live, yoga classes, et cetera. In my own practice, I really like to focus in on all the things that we've talked about, but particularly mind-body practices. And I think the challenges are really trying to understand what are the barriers, what are the needs, and managing expectations, because mind-body practices are very variable, may be different for any individual from another patient, and can be very different day to day. So what resonates with me one day may not the next day. And that's challenging about mind-body practices. But that's how I think about this field and how it's coming into our mainstream.
Very interesting.
Can I just add something? Can I
add please,
about the importance of stress management, as Dr. Mishra is mentioning? I used to start my consultation with a new patient by saying, tell me your story. I actually stopped doing that because I got low grades on Doctor Knew My History. So now I've got, but when I did do that, patients often weave the story as if stress caused their cancer. I don't think stress in and of itself causes cancer, but stress is not good for cancer or anything else. Stress is adrenaline or epinephrine, which kills our lymphocytes, the building block cells of the immune system, and stresses cortisol, a steroid hormone, which is an immune suppressant. So decreasing stress is really, really important. And Dr. Mishra, I think, being a little humble and not saying that she's initiating a program of group visits now for patients at the UCSF Helen Diller Family Comprehensive Cancer Center to teach them interventions, mind-body interventions to help decrease stress.
Thank you for bringing that up. Two things just to add on there. One is we are starting to understand scientifically how these practices may be helping. And so Dr. Abrams very nicely is talking about some of the hormonal differences, where are we in terms of our fight or flight sympathetic system versus our parasympathetics. There's also really interesting data around the immune system, cardiovascular, what's happening to our telomeres, which are our protective caps on our chromosomes, what is happening in our brain with MRI imaging. And so there's some really interesting data around why these mind-body practices may be helping, as well as the fact that, yes, they are helping with these symptoms. And then just to comment on what Dr. Abrams was adding about the course, yes, I'm really excited about a course that we've piloted, myself and a colleague, Dr. Atreya at UCSF, and it's a 4-week version, and it's for active cancer patients because it can be really hard to sign up for an 8-week class and actually be expected to show up each week when you're actively going through cancer treatment, surgery, chemo, radiation. And so this is a 4-week version where we talk about mindfulness in the context of mindful eating, mindful movement, mindful sleep, mindful emotional regulation, and try to give some practical tips that can actually be used during the cancer journey. And to be honest, I am a learner as much as a teacher in those courses, which I love because the patients actually help each other understand what might be working for them, what may not, in terms of practical things. And I think also just knowing that others are going through some of the same things that you might be going through is really wonderful for patients to have that connection, which is hard sometimes when you're going through the cancer journey. So yeah, it's been a really wonderful experience.
Thank you, Kavita. Thanks for sharing that. I have more questions, but I'm going to, let Cindy and Jim ask theirs. They also have a bunch of questions for both of you. So Cynthia, please go ahead and ask your questions. All yours.
Okay, well, thank you so much. This is just so exciting to hear about this, this integrative medicine. It's something patients really want to learn more about. It's because something that we as patients have control over, and we could feel like we are helping fight our cancer. But there's just so many words. I mean, and for people who are listening in, for new patients and hearing those terms, can just, Dr. Abrams, can you just talk a little bit about what conventional medicine is? Is that the same as Western medicine? And you mentioned something about Eastern medicine and what's that? And that this is complementary, meaning that you're using it in addition to, as opposed to alternative, all these terms that that patients just may be confused about because they're hearing it, but they really don't understand it. Yeah.
I think you did it pretty well in asking the question. So we used to call this CAM, which I think is a very bad word, and it's complementary and alternative medicine. And the reason that it's a nice acronym, you can say CAM easily, but something cannot be complementary, which, as you say, means in addition to, and alternative, which means instead of, at the same time. So integrative medicine, as I mentioned, is combining conventional medicine, which is, since we are in the West, I guess you could call it Western medicine. It's your conventional anti-cancer therapies with complementary therapies, which include the broad spectrum of, lifestyle medicine, nutrition, physical activity, plus supplements, plus mind-body interventions, stress reduction, and then the Eastern modalities that we've mentioned, traditional Chinese medicine and Ayurveda. So yeah, there are a lot of terms, but integrative is what we like to say now because we're integrating those complementary therapies with conventional care. You might also say holistic, because again, we're looking at the whole person and not just their malignant tumor. And so holistic is another word for the type of approach that we're using. And your point about control, exactly. That's what I say when I lecture about integrative oncology, that I am giving to the patient back control. Because when you hear the words, you have cancer, your locus of control has been ripped out from underneath you.
Right.
You're now at the mercy of the surgeon, the radiation oncologist, the medical oncologist, even the chemotherapy nurse. So in my 1 hour new patient consultation, we discuss things that the person can control: their weight, their diet, their physical activity, their use of supplements, their mind-body, stress reduction, and obtaining traditional Chinese medicine evaluation. I also like to ask my patients at the end of my history 3 questions. What brings you joy? What are your hopes? And where does your strength come from? And that makes people really think about what's important to them, and sort of gets into this element of spirituality, which I also think is really important in cancer care.
Great. Yeah, I'm so glad that you guys are starting to do this, because I've been living with myeloma now since 2008. I do a lot of mentoring to newly diagnosed myeloma patients. And the very first thing any new patient wants to know: should I eat a special diet? Are there supplements I could take? Maybe I need to exercise more. And when they talk to their myeloma doctor or their general oncologist, they say, oh, just follow the guidelines or do this. And they want more. They really do, because they feel that's something that they can take part of and be actively involved in their care that way. So I'm glad now we're seeing because I'm also a science geek, some of the science behind it. It's not just, oh yeah, that may help. It won't hurt, but it may help, but really saying it's going to help, and so, but integrative medicine is even more than just lifestyle medicine from what I'm hearing you're speaking. But my next question is, do all cancer centers have an integrative oncologist there? I mean, I think it's so important that if you're really interested in this, that you talk to someone who really understands what they're saying. Like Dr. Abrams was telling me, like, okay, this is what I do for people, but not for patients that have blood cancers, because these mushrooms may cause something else. So it's important that the person you're talking to knows that kind of information. So how do I, as a patient, find someone that I can trust? Because it's going to be variable from cancer to cancer. So Dr. Mishra, is that how you say it?
You got it.
How do I find someone? Like, you guys are in San Francisco. I'm in New Jersey. I can't go visit you every couple of weeks to have a consultation. So how does that happen?
Again, great questions. I really appreciate the thoughtfulness of it. It's a complicated thing, so we'll talk about a few parts of it. First, you're totally right. A lot of patients are interested in either trying it on their own from something they heard from their neighbor or family or friend, and often a non-medical source. And very often they are not reporting it to their cancer teams. And so there are some numbers that are out there, but something like 80% of patients may be using some form of integrative oncology practice, but only about 15% actually report it to their teams. So one step is for folks to be able to feel comfortable to say, hey, this is something I'm interested in or want to try or am doing, so that their cancer team is aware. Then the question of, how do you find integrative oncology? How do you find the specialists? It is really difficult. Obviously, a lot of the major cancer centers now do have some sort of integrative oncology team or symptom management team. Most places will have, a nutritionist, exercise counselor, physical therapy, and maybe some mind-body practices or courses. And then there are obviously online services, our webpage at UCSF Osher has a lot of information around nutrition. The American Cancer Society, there's other national organizations like the American College of Sports Medicine has some really neat information around exercise as medicine. Dr. Abrams was talking about some of the sites around supplements, but it's complicated, it's hard. And sometimes it takes a little bit of maneuvering to find your way. I've heard from patients that there are various Facebook groups where they might be able to get some information on who might be good to connect with. And Dr. Abrams, I don't know if there are other things that you're thinking about in addition to that.
Yeah, the Society for Integrative Oncology has a website where people can access and look for an integrative oncologist. You're in New Jersey, Memorial Sloan Kettering in New York City has a whole integrative medicine department. In fact, our last few presidents of the Society for Integrative Oncology have been from that program in Memorial Sloan Kettering. Many cancer centers have integrative medicine attached to them or an integrative medicine center that's, especially if you're an academic medical center, most academic medical centers in the United States now have integrative medicine programs attached to them. And many of those places are equipped to see patients living with and beyond a cancer diagnosis.
That's good to know. I guess the message out to the patients that listening is to ask, because it seems like everything else, if you don't ask, sometimes you're not told, that, oh, we have this wonderful program here that you could be part of, and that brings me up to another question of access to these programs. Are these programs covered by insurance, and if they're not, or like, how about there, people who have cancer, they suffer from so much financial toxicity to begin with that, enrolling in some program that's going to cost more money that they're not even sure is going to help them, it's a big decision. So can you address that issue of access, insurance, so we're not creating disparities in these programs? Anything on that? Either of you? I don't know. Both of you?
Yeah, well, the Osher Center for Integrative Medicine only accepts insurance. So every patient I see is covered by their insurer. If I recommend that they get massage, for example, that might not be covered. If I recommend acupuncture, many insurers do cover acupuncture, but not all do. At our center, as Dr. Mishra said, we have nutritionists. We also have a personal trainer. All of those are free or covered, by the insurance. So it really depends on the center and how they're set up. But, we do accept insurance for all of our services.
That's right. And I'll just add that there are sometimes, for example, for acupuncture, sliding scales that may be available. Different folks may offer that. Same with manual therapy, massage. And for example, the pilot that we're doing in group medical visits, that's all through insurance covering mind-body practices, learning. So yeah, we're trying, it's an excellent question. I think insurance companies, the more that we as a medical group and patient advocacy group can show the insurance companies that, hey, this helps for these symptoms, more and more, I think we'll make headway in that. For example, Dr. Abrams actually just last night sent me a paper which was excellent around exercise and folks' survival for cancer. And almost a 5x difference for folks who are sitting more, exercising less versus folks who are sitting less, exercising more. And that is a massive difference in terms of risk and survival, recurrence risk and survival. So it takes time and it takes maneuvering, but there are resources today, and we hope that we will continue to push the science forward to make headway there.
Thank you for that. That leads me to my last question, is that paper that Dr. Abrams sent you. Can you just talk about some of, is this evidence-based? Is this just because you have a hunch that this works? Like, and what are some of is the evidence-based like in cancer in general or specific cancers, or just anything about, research backing up what you're finding?
I can start, and I'm sure Dr. Abrams will add on. This is, as scientists, I am, and our integrative oncology in general is really trying to have evidence-based, evidence-informed data to support these recommendations. And so, for example, what Dr. Abrams was mentioning earlier around acupuncture, that has been shown by multiple studies in multiple cancers to help with, for example, chemotherapy-induced nausea and vomiting, such that now it is part of the national guidelines for care. And so that is kind of the sort of steps that we want to take, which is we see a benefit anecdotally, perhaps, we do studies, we get to a place where we actually get it into the national guidelines. The exercise, the paper around exercise was a really excellent survey done by the Haynes study that's been running for decades through the US, I think affiliated with NIH, but basically looking at 1,500 cancer survivors and looking at, hey, folks who are sitting more than 8 hours a day, exercising less than 150 minutes a week, how did they do compared to folks who are sitting less than 4 hours a day and exercising 150 or more minutes a week? So very scientific, looking at a broad spectrum of cancers across the US, and found this very significant difference, this 5x difference. And that is in line with other data that's come out prior in meta-analyses, other smaller randomized trials. So this is good data in our current language of medicine that shows certainty around benefit. So yes, the aim is for integrative oncology to really base our recommendations on evidence, safety, efficacy, to make those recommendations for patients. Dr. Abrams, you want to add?
Yeah, I do want to. You bring up exercise and physical activity. So when I have my conversation with patients about nutrition, I follow the American Institute for Cancer Research, World Cancer Research Fund guidelines. Those are 10 guidelines for reducing the risk of cancer, although number 10 says for cancer survivors, follow the 9 guidelines above. And the number 1 guideline is to be a healthy weight. We now believe that 40% of all cancer in the United States is related to overweight or obesity. It has surpassed tobacco smoking as a avoidable cause of cancer. And the number 2 recommendation is to be physically active. And that's one way to maintain a healthy weight. They changed the guideline in 2018 when they updated it from 2007 to just move more, sit less, which I don't like, because in 2007 it said, be physically active for at least 30 minutes a day. And I think that prescription of a time is a better guideline than move more, sit less. What does that mean? Again, the paper that Dr. Mishra just mentioned did talk about people sitting for more than 8 hours a day. I couldn't even picture doing that myself. I'm a little bit hyper, but physical activity has been shown to decrease the risk of breast, colon, and prostate cancer, are 3 most common cancers. And people with cancer who implement a program of physical activity after their diagnosis also have survival benefits. And that even not only breast, colon, and prostate, but even pancreatic cancer, which is one of my most difficult challenges. So physical activity, the number 2 guideline, is key. And the paper that we just shared really emphasized that. Now, when you talk about evidence-based, that's what your oncologist really wants, is evidence-based, because we're dealing with a bad disease and we use toxic medications. But your integrative oncology wants evidence-informed, because, I can't do a randomized placebo-controlled trial of massage. What is placebo massage? Or tofu? What is placebo tofu? Many people think tofu is already placebo. So, we do a lot of sort of evidence-informed as opposed to evidence base from randomized placebo-controlled clinical trials.
Okay. Well, that's good too, because as a patient advocate, I feel that if I'm starting to gather this evidence-informed information, I could start talking to my insurance companies or things to help pay for these, interventions that are going to possibly help me live longer or not relapse as quickly and cost their company a lot more. So thank you so much. And that's enough for me. I'll let someone else talk.
Thank you, Cindy. Jim, you can ask yours. You two have a lot of questions.
My questions are going out the door right now. You guys have opened the window a little bit too much for me. I had prostate cancer 10 years ago, and I was kind of frosted by misinformation by doctors, by urologists, who were proprietarily suggesting surgery or radiation when they owned the radiation clinic. And we saw evidence of this in New York, blah, blah, blah. I did HIFU when I left the country to do it. It cost me a little bit of money, but I'm okay. And now I have people finding what I publish online, and they call me up from all over the country, and they're guys, and guys just suck at doing their own research and trying to find out solutions. They want to know, just tell me the answer. Who do I go to? So I give them a list of questions. Here's what to ask your doctors. See more than one doctor. And my doctor in Florida, Dr. Ciante in Florida is a fabulous resource. He'll talk to anybody, but guys aren't good at this part. For me, when I had cancer, my son was I'm going to cry. I had cancer. My son is in a coma with epilepsy, and my mother's dying. I can't fix it. And I started downloading music, but I didn't know. I didn't know it. I'm downloading dance music. I'm downloading music about love, but I didn't know it. So I'm going to work out heavy. I'm a surfer. I'm surfing. I come home and turn this music on again. This music therapy for me that I didn't know I was doing was right there, but I didn't see it. I've tried to share this with the friends of mine who have had cancer, but you can't tell. You have to allow. And so that's what I've kind of done on my level, but now I'm okay. My son's okay. But the challenge is when it's easy to look at someone else who has cancer, and I have friends who have cancer now. But when it's you who has this cancer and you're looking for alternative treatments, it's a blur. There's too many things to look at. Joe Public cannot disaggregate all of these choices. They're heading off to Takati to spend $15,000 for a cancer therapy that doesn't work. And we've all seen these treatments that are just abusive in my mind. And we've seen people enabling these ridiculous fake solutions that I feel bad there's not a pushback by the medical community, because there's really not. We're all living our own little bubble as a medical profession, and patients don't know how to disaggregate anything. They try their best to get through each piece, but it's hard. And I look at patients who call me and I'll give them the choices. One of my close friends who was a top athlete, we're all athletes, he's still going through each step to try to figure out things. He doesn't want to look at alternative therapies. He's going to go right into radiation in 2 weeks because that's what he feels comfortable with. But I think as a Joe Public, how do we use integrative thoughts with oncology to get the word out? There is no avenue. There is no pathway. Harvard Medical School has great publications on diet, Mediterranean diet and DASH and stuff that are really fabulous. My diet's killer, but you can't get people to do that because once they start, they don't keep it going. Exercise. Oh yeah, I got to exercise now. And they don't exercise. You guys know what I'm talking about. So I think the message I have is, how do you get from point A to point B in the medical community so Joe Public hears what is being said here? Sorry for my diatribe, but I didn't know how else to share it. Any ideas of how to integrate Joe Public?
Well, I'm smiling. I'm thinking of, one of those listservs sent me this physician someplace talking about people dying of COVID and the tendency for people to be overweight and obese, and how Boris Johnson, this is what the guy said, in the Prime Minister of England, has now appreciated that and is banning sales of all sorts of toxic foods in England. Now, whether or not this is true, I don't know, but the answer to your question is, we as a country, need to stop supporting advertising of junk food to people, because this is what's causing, dietary issues are the number one cause of both morbidity and mortality in the United States today. And we're at the mercy of companies that have a lot of money that, advertise, particularly to children. The obesity epidemic in children is alarming. And, I don't know how to get to Joe Public other than modifying the system that we currently use of disseminating information about health, because it's broken. I agree with you.
In my profession, I was in education. We created a physical therapy program for schools all over California. We spoke at the CAPERG conference. I taught inner city. Those kids have no choice of what food comes to them. There's so many food deserts. If you can drive through areas of LA, you can go miles and you can't find any place that has food. People don't have transportation there. Cheap food is bad food and it's too cheap. And we've educated children and students in that educational setting, but they have no help because their parents bring home food they can afford, not the food that's necessarily good for them. And the food desert thing is a huge issue. Then it goes along with obesity, because when you become obese, you don't exercise. And so it's a mixed bag right there on both ends of this. And having worked in inner city, I don't know the answer, because there is no infrastructure in America or California where we are to fix this as I can see it. So I guess I'm not asking a question, I'm just stating my opinion.
Well, you're right. I mean, you're right. Again, when I used to lecture to the third-year medical students at San Francisco General, which is our safety net hospital, about nutrition and cancer, they would always raise their hand at the end and say, well, what about our patients here? And I would say, yes, my organic apple costs as much as a double cheeseburger, fries, and a shake. And that's unfortunate. And we do subsidize the wrong information. Now, I just read, talk about evidence-based, an article about the sulfur promoting microbiome leading to increased risk of colon cancer. So I said, what is a sulfur promoting microbiome? And it's diet, soft drinks, French fries, and processed meats. How much of America lives on that?
Yeah.
It's a problem. It's a problem.
Let me ask you this. There's a man I've traveled with before. His name is Bob Wales, and he's the new California Medical Association director. He's a great man. I'm going to see him next month. I want to ask him questions of, what are you doing? How are you linking big pharma with the California legislature, with the medical community, create positive change? This guy doesn't have to work. He's into this job. He's doing 15-hour days. I respect him a lot, but I want him to create positive change because he can do it. He's in a spot there, but he told me recently he's overwhelmed by it. He spends 15 hours a day trying to link stakeholders together, and it's not easy for obvious reasons we've talked about earlier today. So if you guys have any thoughts for me to ask him, because he's just a good guy who's into it. Mm-hmm. I'd love to know.
It's not impossible. I don't know how many of you are as old as I am, but I remember ashtrays on airplanes. Remember? We used to be able to smoke on air. There was a non-smoking and a smoking section. How ridiculous is that? Now tobacco is pretty much unheard of. If we could do the same thing with poor nutrition in this country that we did with tobacco, I think it would be a huge step forward. Why don't you mention that to your buddy when you meet with him?
Okay.
Thank you, Jim. Thank you for your sharing that with us. Dr. Abrams and Kavita, I have a couple of more questions before we wrap up today's session. Dr. Abrams, what daily habits can help healing through any cancer staging, and how do you help patients through this process?
Daily habits. So I think we should consume an organic, plant-based, antioxidant-rich, anti-inflammatory, whole foods diet. We should be physically active for at least 30 minutes each day. We should take appropriate supplements, get most of our nutrients from our foods, but if we don't, then some supplementation would be good. And we should work to do some mind-body interventions to decrease our stress. We currently live in a very stressful environment with this ongoing 2-year pandemic that we've been dealing with, but you really need to do what you can to decrease your stress so that you can sleep well, because we haven't talked much about sleep today, but sleep is really important for us as people. And I think getting a good night's sleep, going to sleep at the same time and waking up at the same time is recommended. And again, we didn't talk about fasting. Fasting seems to be the new sort of ketogenic or paleo diet. I think we should eat 3 meals a day personally. And I'm not a big fan of fasting intermittent or otherwise, to be honest. So I don't know. Dr. Mishra, what do you think?
I'll add a couple thoughts there. That's wonderful. In terms of fasting, in speaking with our exercise specialists, our exercise oncologists, the issue with intermittent fasting when you're doing 16/8, sort of the version that many are talking about, for cancer patients in particular, one can lose muscle mass, and we don't want that. And so generally what I'm hearing from the folks in nutrition and exercise oncology is that around a 12 or 13 hours where you eat at 7 p.m., you eat again 7 a.m. or 8 a.m., that is a sustainable, potentially healthier way to go, especially as you're going through a cancer journey. So I'll just add that piece. And then there are so many things that we've talked about that the one comment I'll make for patients is it can feel overwhelming to try to think, oh my gosh, I need to go do this with my nutrition. I need to go do this in terms of exercise. And a little bit of what, Jim, you were talking about, which is, boy, you might start something, but then how do you actually maintain it? These are potentially transformational practices, and it requires your own input into it, right? Your time, your effort. And so starting with 1 or 2 priorities is something that I often talk to patients about, which is there's 30 things that might be on the list of things to think about, but let's start with 1 or 2 items. Let's try that for a few weeks or a month or whatever, whenever I see you next, let me know how that goes. Then we'll add on something else depending on what their greatest need is and what is their greatest barrier. So I'll just add that in terms of habit forming. Habit forming is really difficult. So taking it step by step.
Just one last question to both of you. I don't know if this question is right, but could you kind of name 3 side effects that, of cancer treatment that mind-body practices or eating right has actually helped and we know about it? I know you did mention acupuncture and nausea. Anything else that we are sure that would help with?
Well, I'll start, and Dr. Abrams, please add in. For every single one of the things that we've talked about, there have been evidence-informed, evidence-based data that's come out showing benefits. So for example, everything from physical symptoms like sleep, fatigue, pain. Something that we didn't talk about was xerostomia or dry mouth, where acupuncture has really shown that it can reduce, not only during the radiation period, but even up to a year out, some of these symptoms. And so these are very practical physical symptoms that mind-body practices, acupuncture, et cetera, can help. On an emotional level, we have definitely seen that, for example, mindfulness-based interventions help with depression, cancer-related anxiety, cancer-related fear of recurrence. And then I'd say that, for example, the exercise paper that we talked about was very clear, and some of actually the dietary information that Dr. Abrams is sharing is very clear in terms of risk reduction, so less chance of recurrence of cancer. And now we have fairly clear evidence of survival benefit. So it really spans the physical, the psychosocial, as well as the recurrence and survival risks. Dr. Abrams?
Thank you.
Yeah, the question was mind-body interventions are good for what symptoms? Is that
Yes.
what you, I mean,
Yes,
we haven't talked about pain much, but I think that, many of the things that we do are dealing with pain, because cancer patients often are dealing with painful issues. And I think that, acupuncture for one is something I like for pain. Mind-body interventions, I guess you can get some control over pain. I'm not aware of all that evidence. Some of the supplements may be useful. Turmeric, for example, may be something that's useful for pain as well. So I think the symptoms that we deal with the most are pain, insomnia, nausea, vomiting, and loss of appetite. And one thing that we haven't talked about, and we're right at the end of the day, of course, is cannabis, which is something that I've studied and which I recommend to patients, because it's one thing that can really deal with all of those symptoms that I just mentioned. So I am a big proponent of cannabis for symptom management, although I don't see it as something that cures cancer, as many of my patients believe it might.
You said in a previous show on cannabis, so you said one of your patients said to you, I heard cannabis can cure cancer. And you paused, and my recollection was you said the only people who believe that are dead, I think is how you worded it. Is that correct?
Not exactly. I said I've been an oncologist in San Francisco for 39 years. And if I would venture to say that most of the patients that I've taken care of have used cannabis. And if cannabis cured cancer, I probably have a lot more survivors. So it's sort of a rephrasing of what you said.
Sorry.
Yeah.
Thank you, doctors. So with that, I think we can wrap up today's discussion. Dr. Abrams, Dr. Mishra, thank you very much for taking time to join us on Cure Talks today. Cindy and Jim, I hope the discussion would prove useful for the cancer community, and thanks for joining and asking these great questions. We also thank UCSF Helen Diller Family Comprehensive Cancer Center. This talk will be available on curetalks.com. Thank you, everyone, and have a great day.